In the recent years, we have been seeing a gradual increase in the incidence of Caesarean section. So today we will talk about Caesarean section in detail. Hi friends, this is Dr. Rajeshwari Reddy. I am an obstetrician, gynecologist and a laparoscopic surgeon from Hyderabad. There are two ways we do a Caesarean section. One is the elective section where we schedule the operation on a particular date at a particular time where normal delivery is contraindicated. Example, cephalopelvic disproportion, small stature, placenta previa, antepartum hemorrhage, some obstructions to the birth canal, transverse lie of the baby, etc. The second type is an emergency C-section, which may be because of either fetal distress or maternal distress. In either case, the procedure of doing a Caesarean section is almost the same. But in this video, I will be talking only about elective scheduled Caesarean section. Before admission, a series of pre-operative investigations are done, after which a pre-anesthetic checkup is scheduled and done by an anesthetist. Most of these investigations are done for all women during pregnancy. There might be just one or two tests that we may want to repeat. Counseling of the procedure, anesthesia risk, hospital stay, etc. are done at this time. The patient is asked to have a very light dinner the previous night and to be nil by mouth, which is 8 hours preceding time of the surgery. They should not be having even water or any kind of liquid. The patient is asked to report to the hospital at least 2 to 3 hours prior to the scheduled time of the surgery, and on arrival, the admission formalities are done. The patient is taken to the pre-op ward. She is made to change into a hospital gown. NST is done to record the fetal heartbeat, which also is a reassurance for the mother about the fetal well-being. IV line is secured. The gynecologist and the anesthetist do a final recheck of all the documents, and the patient is wheeled into the operation theatre. The patient is given spinal anesthesia either in the sitting position or in lateral lying down position. Then the patient is put to straight position or supine position after anesthesia, and a Foley's catheter is placed in position to drain the urine from the urethra. The abdomen is cleaned with an antiseptic and draped fully from just below the chest to almost the mid-thigh. A transverse incision is taken about 6 to 8 centimeter just above the pubic symphysis. The abdomen is opened in layers. Then a small niche is put on the lower uterine segment and it is extended laterally. A baby is extracted from the womb and delivered. Suction of the mouth and the nose of the baby is done. At this time, the mother can hear the baby cry. Then the cord is doubly clamped and cut. The baby is handed over to the pediatrician. The placenta is delivered in toto with the membranes. The uterus is then cleaned and we reassure ourselves that the uterus is completely clean from inside, and then the uterus is closed in layers, and then the abdomen is closed layer by layer. Then the patient is cleaned and shifted to the post-op ward. The patient is kept in the post-op ward for observation for about 4 to 6 hours. She is then shifted to her allotted room. She will be allowed to take liquids orally, usually about 6 to 8 hours of time post-operatively, and then slowly, based on how the patient tolerates, we allow them semi-solid diet and thereon a normal diet as time goes by. The catheter will be removed as per the patient comfort. Whenever the patient is comfortable enough to sit or just to walk a few steps, that is the time we remove the Foley's catheter. Then she will be mobilized the following day completely. Like she will be allowed to walk around normally. The patient is discharged usually on the second post-op day with oral medication and asked to come back for suture removal after 1 week. The total recovery time is about 4 to 6 weeks post cesarean, but this is basically based on the preoperative health condition of the patient, her pain tolerance, more so the mental preparedness of the patient. The patients who do well are the ones who are really prepared well preoperatively. So I think every mother should be aware of her choices of normal delivery and cesarean. Whether we are opting for normal delivery or cesarean, it's very important that even all normal delivery patients also should be aware of what a cesarean is, how it is done, and how is the post-op follow-up, and what is the exact procedure, what is the baby outcome for it, and the maternal outcome. All these things should be counseled pre-operatively. I mean, all these things have to be counseled even before the admission into the hospital. Thank you.